Hi, everyone, and welcome to the Dane County Podcast. I'm Dane County Executive Joe Parisi. Today, I am joined by Cheryl Wittke, the Executive Director of Safe Communities Madison-Dane County, and Charles Tubbs, who is the Director of Dane County Emergency Management. We're going to be talking about the opioid crisis today. We're going to take a look back in history. We're going to get an assessment of where things are and where things are going. And we're going to talk about what's being done in the community and what is on the horizon. This is certainly a crisis that's impacting all of us. Most of us know someone who has been impacted directly or indirectly by the opioid crisis. And it's something that our community is putting a lot of energy into addressing. And we hope to further inform people today. And hopefully this podcast can be helpful in not only letting you know what's going on, but if you or someone you love needs some help, hopefully this can help guide you toward a path to start receiving that help. So I think we're going to start with introductions. Again, first with us today is Cheryl Wittke from Safe Communities. Cheryl, welcome.
Thank you so much for having me, Joe, and for everything that you're doing to address this issue.
Well, thank you. I appreciate it, and likewise. Cheryl, could we start by having you just give us a little background about Safe Communities and your role? You know, what you're involved with, and because you're an organization who does so much, but I would wager that most people in Dane County aren't even aware directly of you as an organization. They may see, you know, some of the efforts that you're doing and the initiatives, but you have such an impact. And so I think it would be great if you could just give us a 30,000 foot view of Safe Communities.
Oh, my pleasure. Thank you. So Safe Communities is a coalition of about 350 organizations, and I think that's what makes us unique and maybe a little bit invisible, is that we work with a lot of partners to address Dane County's top causes of serious injury and injury-related death. And so those are, you know, sort of consistent across the state and actually across the nation in most cases, but there's Safe Communities across the country, and they are also looking at the data. So what are the top causes of injury in their community? We've got some communities that are working to reduce rattlesnake bites. So we're very much a data-driven organization and pull together partnerships to address these problems.
Great, thank you. And Charles Tubbs. Charles has worn many hats. He's the former Chief of Police in Beloit. He was the state capitol police chief when I served there in the legislature, and we were fortunate enough to have him join us now as the director of Dane County Emergency Management in Dane County government. And in addition to Charles' work that he does professionally, he's deeply involved in the community and certainly deeply involved in helping to address the opioid crisis. So Charles, could you give us a little overview of Charles Tubbs and some of the things that you're involved with?
Yes, thank you. And thank you very much, County Executive Parisi, for your great leadership here. Thank you, Cheryl. And I really appreciate the opportunity of you allowing us to participate in this life-saving podcast. It's a very powerful message that we're trying to produce and get out to the citizens as well as our co-workers throughout the county on how critical of a situation we are dealing with the overdose issues that we're facing, not only in the county, but across the country. I am the parent, my wife and I are the parents of a 32-year-old who lost his life in his battle with doing an overdose where he had injected marijuana laced with fentanyl that took his life 3 years ago. Very painful impact on the family and on the loved ones, and it's a situation that we have to be addressing, identifying, which we're so proud and so thankful for you, Joe, taking the leadership role on this whole situation. So I do always have a lot to say about this. I believe as a group of people, we can make a difference. I think the things that you have initiated here in Dane County, the great work that Cheryl's doing, will have a major impact on saving lives of our loved ones here in Dane County.
Charles, thank you. And, you know, I think it goes without saying how much we appreciate your willingness to come and talk about what is obviously probably the most painful event that a human can experience, that's losing a child. And I think what's been so remarkable about your family's journey is that you have taken your grief and you have decided to take a positive, action-oriented response and doing everything that you can from everything that you've learned in order to help other families be able to avoid the situation that you've had to endure. And I think really it started out, and again, and let me just stand back and say, first of all, there's no right or wrong way to grieve, right? And everyone has their own process, and however one chooses to deal with a situation like this is okay. That's for them. If people don't want to talk about it, if they want to be private, if they want to talk about it, the whole range, everything is okay. There's no right, there's no wrong. What you did, Charles, I think helped other families realize that what they were going through was something, unfortunately, they weren't going through alone, and that there's no really good roadmap. But just knowing that others experience this and that there are folks you can turn to was very powerful. Right away, your family came out when CJ passed, and you talked about his history and his struggles and what happened to him. And that opened up a lot of doors, and that opened up the doors for a lot of positive action that we'll talk about during today's podcast that has resulted from your work. So thank you again for all of that and for being here today. Words can't express how much we appreciate you.
Thank you.
Thanks. So, Cheryl, I thought it might be helpful. Could you talk a little bit? I guess I have two questions for you right off. Could you talk briefly about the portion of Safe Communities that is dealing with opioids? Because as you mentioned, you're a vast organization. Could you talk a little bit about that piece? And, I'd be interested, I think it might be interesting for our listeners to get a little bit of a background kind of on the opioid crisis, right? I mean, it really has come into the news the last few years, but it's not new. It's evolving, and there are new and dangerous aspects to it, certainly the fentanyl piece. But could you talk a little bit about, and I'll let you frame it in whatever way and whatever time period you think is best, just kind of how we got started on this and the evolution and where we are today.
Yeah, it's been really interesting to look at how this issue emerged and how it's evolved. So if you remember, Joe, because you were the convener basically of an initiative that brought together a lot of partners with Safe Communities, staffing support, a lot of community members to look at this issue. And what we found by looking at public health data was that for the first time, we were seeing deaths from opioids, drug poisoning deaths. And that really, we saw a tripling of these deaths between 2000 and 2010. What was interesting was that the deaths were primarily from prescription opioids. And you could pretty much track the increase in deaths to the increase in prescribing of opioids. And at that time, there was a belief, somewhat manufactured by the pharmaceutical companies that produced opioids, that people couldn't become addicted if they were using opioids for pain. And of course, we found that was not the case. There was a massive amount of prescribing of opioids during this time frame, and as a result, more and more people became addicted to the opioids and died from overdose. Then what happened, I think we really pulled together a partnership of prescribers and said, together we need to address this overprescribing issue and also look at harm reduction. So for example, co-prescribing of, naloxone, which is the agent that can overturn an overdose. So we had a partnership with all the healthcare organizations in town then, was convened by Safe Communities to look at prescribing practices. And that really helped. I mean, we definitely have seen a reduction in prescribing of opioids. Then what happened is that we saw, because there were so many people who were addicted to opioids, prescription opioids, and maybe they no longer had access to these prescription opioids. Sometimes it was a little bit of a clumsy process of getting people off of them without treatment options. Then what happened was people turned to heroin and illicit opioids. And that's when I think we became more concerned about addressing people's addiction. And that's when the whole recovery coach initiative that Dane County's been so instrumental in, funding and supporting took off. So we have recovery coaches in the emergency departments that, they're there when somebody wakes up after an overdose. Pregnant women, if we see an increase in use among pregnant women, rather than stigmatize them, because they're facing an addiction, try to get them into treatment and with the help of a recovery coach. And now finally, what we're seeing is an increase in illicit fentanyl in everything from counterfeit prescription drugs to cocaine to other substances. So what's happening there now is we're seeing an increase in overdose deaths among people of color who maybe would use cocaine more so than another drug. So now Dane County's African American population is 3 times more likely to die of an overdose than our white community members. So that's been sort of the evolution. And what's particularly dangerous right now with fentanyl is that such a small amount of fentanyl is deadly. And so we have to be looking at harm reduction. We have to look at much more, Narcan distribution and fentanyl test strips to address that problem.
Yeah, thanks, Cheryl. And when we get to the point where we're talking about kind of our current and future initiatives, I'd like to revisit that fentanyl piece, and because it is so critical to this crisis. But before we move on, the history of the opioid crisis is interesting, and unfortunately there are certainly aspects to the opioid crisis that we've seen, certainly through the COVID crisis, through other crises, that exposes underlying challenges in our society and racial disparities and plain out racism in our community that folks maybe don't see at first. But what we've seen, and correct me if I'm wrong, and I'd be interested both, Cheryl, from your perspective, from the work you do, and Charles, your perspective, both as an African American and a member of law enforcement for your entire career. My understanding of the opioid crisis, it goes back to the days of crack cocaine, right? And what we saw during crack cocaine was it wasn't treated as an addiction. It wasn't treated as an illness. It was treated as a crime, and people were thrown in prison for very long terms for being addicted to crack cocaine or smoking crack cocaine. And there are still people in our prisons today because some of the, quote, war on drugs laws that were passed, that after a certain number of offenses, people would be locked up for a long time, if not forever. Now, we saw that evolve, as you mentioned, during the opioid crisis, and there's really no escaping from where I sit the fact that when this crisis really began in earnest to show its face, it began in the African American community and was treated as a crime. When it began to impact the white community, when we saw it through prescription drugs, et cetera, as you mentioned, and we saw, people from the suburbs crashing their vans because they'd just gone out to find some heroin when their prescription ran out, and we began to see it touch home in the white community, then the kind of general psyche shifted and the paradigm shifted to recognize this for what it is an addiction and an illness. And now we're seeing even that kind of that full circle, as you mentioned, Cheryl, with fentanyl being more and more available. And now it's the Black community that's being hit, even harder than before. And so now this is an equal opportunity, challenge, right? The white community, the Black community, brown communities. But, when are we going to get to a point where we can look at human beings who have an addiction or a challenge and treat everyone as a human being? Because what we've seen is, from my perspective, that war on drugs, get tough on crime piece, and it didn't work. And it's really, a tragedy, an American tragedy, that is still being felt today in communities of color, that this was the approach that was taken. And, Charles, I'm curious from your perspective, your multiple perspectives, do you have any thoughts on this? And am I accurate, kind of in my observations?
Well, Joe, I think you're very accurate and very right on time here. I go back to 1973 when I started in the law enforcement agencies. At that time, alcohol was a real major problem. And at that time, I felt locking and arresting people or alcohol charges other than OWI, those types of things, we needed treatment. And I started pushing the treatment way back in 73. And I was looked upon as not taking a tough approach on the criminal activity. And I continue to pursue that as I do today, as I feel that this addiction problem is a serious, very serious medical problem. It knows no race, no age, no gender, or no income. And it has been a major impact, yes, in the African-American communities. As a former administrator of the Department of Corrections here in Wisconsin, I've seen a large number of people of color incarcerated, as you mentioned, for a long period of time for drug charges on the get tough drug arrest, get tough on crime, get tough on drugs. And also I saw a large percentage of white people as well incarcerated for these same charges, where I honestly believe treatment is the answer. Treatment, holding people accountable, responsible, and sanctions as well, just not punishment.
Yeah, I agree. Because I look at the impacts. I mean, addiction has generational impacts in and of itself, right? Even if someone receives treatment, challenges that occurred during that time of active use can have impacts that reverberate through generations. So if you include incarceration and criminalization on that, then you just multiply probably exponentially the negative and generational impacts. And I think that's something that we all need to remain mindful of as we encounter people. Even if someone didn't have an addiction themselves, if they had a parent who had an addiction, there are a lot. I run into so many kind, compassionate people in this line of work who are doing so many good things and in the community. And for example, when it comes to working around incarceration or working around the opioid challenge, and what we find is when we do the compassionate thing, it's also the smart thing, right? I mean, we used to look at get tough on crime. It's like, let's get smart on crime, right? What do we all want? We all want to be safe in our communities. We all want our neighbors and our children to be safe and to be able to reach their potential. And so, if we could look at everyone we run into who's suffering from addiction as though they were our child or our brother or our sister and say, what if, and address it from that perspective, not only is that the compassionate thing to do, it's the smart thing to do, because that's how we solve these challenges. So, well, enough of my soapbox. But Cheryl, I'm just curious, do you have any thoughts, any additional thoughts on kind of that evolution and just the racial and ethnic, kind of piece of where we've been and how this has been addressed and how that's changing?
Well, I think you're absolutely, the data supports everything that you said. And when the African American Opioid Coalition formed, which is a group of African American leaders who are working together to address this problem in Dane County, I think they really needed to spend some time processing just that. Why is it that our community, when we were ravaged by the crack cocaine epidemic, that the response was lock them up, and now that it has predominantly been, something that's affected upper middle class white people, there's a move towards treatment. And so the African American Opioid Coalition, I think, began with in mind, how can we make sure that the treatment is fair and culturally competent? Because we are also facing addiction in our communities. How can we make sure that the treatment resources and the information is being presented in such a way that it's going to reach our community and make sure that it's not a criminalization of the problem again?
And I do think, just to add to the work that's being done in Dane County right now, under your direction, County Executive Parisi, Safe Communities, a number of agencies, is really going to help improving that trust that's been broken between people of color. I'll tell you, the distrust is greater than it's ever been, and I think we all recognize that. But the work we're doing right now, I think, is going to have a major impact. It's not going to be an overnight fix, but I can tell you right now, I'm seeing improvements in relationships. I'm seeing more people willing to work together, stand together. And it's all starts right here. I know people say government, it's a government problem, and government can't do everything. And I totally agree. But in this case, government has taken a leadership role in addressing the issues that are facing and has faced our communities and communities throughout the country for years. And I'm very appreciative to be part of that group.
That's a really good point that when we look at this effort kind of community-wide, we'll focus on Dane County, obviously, is that this is really a team effort. The community has skin in the game. The community is involved. And I think we're doing the right thing by going to the community and saying, what is needed? How can we help? Because there's no one entity that can solve this problem. We all have to be in it together. And, maybe this is a good point in the conversation to kind of do a little level setting and talk about kind of first I'd like to talk about what's going on now, and then we can get to, what's still needed and what's on the horizon. But Cheryl, you mentioned a couple of things. You mentioned the African American Opioid Coalition. You mentioned your recovery coaches, which again, for folks who aren't familiar with those, these are people with lived experience who we are doing everything we can to make available for folks, immediately when they, coming out of an overdose, right? When they may be, open to needing some help, and connect them with someone who can help. Cheryl, could you give us kind of a, what do you see as kind of the table as it's set today with what's going on in the community to address this issue?
I love the fact that the recovery coaches, also called peer support specialists, are really driving a lot of the work. And so we have people, as you mentioned, people with lived experience. They woke up in the emergency room after an overdose. They've been incarcerated for drug charges, and they've come out on the other side of it. They've been in long-term recovery, and now they're trained to provide this kind of support to people who are facing the same challenges right now. And really, there's nothing that we're doing together as a coalition in partnership with Dane County that isn't informed by their experience, what they see every day. For example, with the fentanyl issue right now, making sure that everybody has extra doses of fentanyl, of naloxone when they come out of jail, because of the knowledge of what's out there. So there's just so much of the effort that's informed by this lived experience that I think that's one of the reasons it's so powerful.
Mm-hmm. Charles, from an emergency management, perspective right now, we work with EMS agencies. I know, you work on getting Narcan to folks. What do you see kind of from that perspective as far as what is occurring in the community, right now for emergency response and prevention?
A real positive. I review a lot of the police documents or blogs and information that comes out daily. And I see, and I'm gonna go as far as saying maybe 3 to 4 times a week, where Narcan has been used to revive a person and save their lives. We made an effort here in the county to make sure all our responders, emergency responders, had Narcan available to them and be able to be trained and be able to utilize it to save a life. And we also have encouraged many of our citizens to carry Narcan and have it available in the event it's needed. The life you save may be your own. Again, I see nothing but positives moving in this direction. And we emphasize, I've spoken in other communities where they're having struggles of trying to get their emergency responders to carry Narcan. And here in the county, it was a welcome event. People stepped up and said, we will do it. They took the training, they carry it. And like I say, I see the results and the ratings of many of our citizens who have been saved by the availability of Narcan. Matter of fact, one person I think was saved twice in one day, as I recall. It was at least twice one day he received Narcan. Now people say, well, he's a drug user, he's an addict, he's a throwaway, he's got a drug problem. We got to always remember this person is a human being and probably didn't choose to be the way this person has become. and looking for ways to get help. And I think by us reaching out, the coaches we have here in Dane County are excellent. I think by being able to reach out and offer them an opportunity to get their lives back, get treatment, stay out of the criminal justice system. Because once you get in that criminal justice system, it's extremely difficult to get out. I mean, there's options and of people to make choices, but once you have no job, you have a criminal record, you can't get a job, you don't have insurance, you can't get treatment. There's a number of ways that, I think our county right now is working to try to improve these conditions for all people.
Thanks, Charles. Yeah, I think people would probably be surprised to learn, A, how many overdoses there are every week in Dane County and how many lives are saved every week and certainly every month and every year throughout the community. Our EMS folks are really, we know that they're the folks we call when we're in trouble, but one would be shocked to know how many lives they save on a regular basis. And we're really blessed in that way, both with, our larger departments like Madison, et cetera, and all of the smaller and regional departments and volunteer departments throughout the region. Those are some special folks. Charles, one of the things that we have now that we didn't have a few years ago is the Behavioral Health Resource Center. And, I think just to give a little background on this, one of the, we look for themes, right? We not only look at what we're doing, but we look at what's missing. What could people, use? What kind of help could people use? And one of the things we constantly heard was people don't know where to turn. Where do you start if you're addicted or you have a loved one or a friend who's addicted? And where do you start? And, for Charles, this was, you shared with me, this was part of your journey with your son. It's even someone as connected as Charles Tubbs, who, believe me, knows everyone on the planet, has been in law enforcement his entire career, and is very plugged in. You shared with me, and please feel free to correct me if I get any of this wrong, my memory, but you shared with me that even at times you didn't know quite where to turn and who to call and where do you start. And so one of the things that you spearheaded after CJ's death was coming together to work with the county, to work with our healthcare providers, to create a place that people could call when they don't know where to turn, a place to start. And so out of that was born the Behavioral Health Resource Center, which is a partnership between all of the local healthcare providers, service providers, to coordinate all of their information so that no matter if you're uninsured, if you have Badger Care, if you have, SSM, if you have Quartz, whatever healthcare provider you're with or don't have, you can call the Behavioral Health Resource Center. And there are live people here right in Madison who will pick up that phone and they will be with you for at least 30 days to help connect you. They'll assess your situation and help connect you to a service provider, help you figure out insurance, help guide you through this path that is a labyrinth that can be very challenging to figure out. And where it sounds kind of like a basic, easy, of course you would do that concept, it took a lot to get there. And we had a lot of different healthcare providers, a lot of insurance, a lot of different ways to navigate. And even people with insurance wouldn't quite know where to start. And you call up, your insurance and you get in this phone tree, and, you can go there and you can see someone in X number of days. That can be very challenging too. And so that's just another result of, the positive steps that you took that are making a difference in people's lives. And the Behavioral Health Resource Center, it's not just for people with addiction. It's certainly for addiction resources. It's if someone has a mental health challenge, they need help, they need guidance. So I think something like that's kind of one of the places we're at as we're, setting the table for the discussion. Something that was missing and a lot of communities still don't have. And, I don't know, Charles, if you have anything to share about kind of your experiences and how important it is to have something like this for people. And we can certainly, include information later on how people can, get the phone numbers for the things we talk about in this podcast also.
Yes, I do, and I appreciate that, Joe. And this resource, the Behavioral Health Center, is critical. It's very critical and has helped and provided a lot of services to people in need. My son had got himself, once you get involved in the criminal justice system at that time, it you're in a position where some services are not available because you are in the system. If you are using their services, is not available. If you haven't had 10 days or 7 days or what have you of absolute sobriety, you may not be available for certain services. Then you're told to go and get in line and get help, to get counseling, therapy, to deal with the situation. You have no job. You have a criminal record. You have, very low resources. Your families who have stepped up and tried to help you through these difficult situations have financially spent out. They are run up their charge cards. They've taken second mortgages on their homes. There's all types of problems that goes along with this addiction. It's bigger than just being addicted. It affects the entire family, the entire community. So I can just tell you, like with our son, after getting the treatment he needed and returning to society to be a positive contributor to society and not a liability, he was an excellent young man. So he went out one night and decided to have some marijuana with friends, and not knowing the marijuana was laced with fentanyl. He came home, he laid down on our couch, went to sleep. We went to wake him up. My wife went to wake him up. He didn't wake up. I went over to wake him up. I could see he was in trouble. I could look at his lips and hands and see that there was a problem going on medically with my son. We administered, as I always do. I carry 2 vials of Narcan every day in my pocket, every single day, everywhere I go, to try to save a life. Because like I say earlier, the life you save may be your own. We administered the Narcan. We began mouth-to-mouth chest compressions. We got paramedics there. We were not able to save our son. But in the beginning, I'm telling you, it was very difficult trying to negotiate where the treatment was going to come from and who was going to provide treatment, because people were turning people away. We're getting better, but we got a ways to go. But I can say what we're doing here in Dane County is making a tremendous impact. If people want help, I think there's people here, especially through our coaches, who will help them, and through our service center. They're able to provide leadership guidance, help, and get people hopefully back on the right track. That's what we need right now. It will have a major impact on criminal activity. People won't be out committing crimes to support and feed their habits. It has a major impact on the employment place, where people are working and making money and taking care of their families. There's so many positives comes from treatment versus just straight incarceration, that I feel that Dane County is really making an attempt to provide that service for our people who are addicted and are suffering from mental health issues.
Charles, thanks for being willing to share. It's obviously really difficult to hear what you went through, and at the same time, for people listening, it makes this very real. These aren't just statistics. These are human beings with families, and they deserve a shot. They have an addiction, just like some people have a physical illness like cancer. We want to deny treatment to them. So, Charles brings up a really important piece of this whole situation that I think is important to touch on. And you alluded to it earlier, and that's the rise in fentanyl. What we're seeing with fentanyl deaths is everyone from some young college person who might be trying a pill for the first time to someone who's struggling with addiction. If there is such a thing as, the manifestation of evil, it's fentanyl. Fentanyl kills, and it doesn't take much, and it only takes once. And could you talk a little bit about what we're seeing, Cheryl, with the fentanyl situation, and what people should know about this?
Yeah, it really is a fright. Apparently some of the deaths we've seen from fentanyl, from the counterfeit pills that people have just purchased them online. And it's very difficult to sort of figure out what the interdiction, what the prevention method is to address that. So a lot of it does have to focus on public education, in addition to the law enforcement piece of it. But, so one plan we have, using the opioid settlement dollars from the Harm Reduction and Prevention Act funds, is a public education campaign that basically tells people, to be on the lookout, what to notice when they're using a substance. We have fentanyl test strips that are going to be broadly distributed. And I think those are critical elements. Everybody from parents to youth themselves in schools to, adults who are out and maybe in the using community, everybody needs to be on the lookout for this fentanyl because it's deadly.
It's really, I think, important for us to talk maybe a little bit about harm reduction and the concept of harm reduction also, because obviously, there are kind of like different levels of what we can hope to achieve, right? I mean, ideally, people would not do illegal drugs. That's the safest. You don't buy pills off the internet, don't buy pills on the street, don't do illegal drugs because, and this is actually even a different discussion than most maybe 60s and 70s when drugs were becoming in more widespread use. But the reason today is because of fentanyl, and it could cost you your life if you don't know where that came from, and it will cost people their lives. And then the next step is harm reduction, and that is if there are people who are going to use regardless, especially people who are addicted and are going to use for now, there are resources like fentanyl test strips that you can use to at least check to see what you're using doesn't contain fentanyl, and if it does, not use it obviously, and get rid of it. And some of the work that we're doing around that now does come from the Harm Reduction and Prevention Act, which is the result of what the county is doing with our partnerships with the opioid settlement funds. As folks may know, Dane County sued and took part in the lawsuit against the opioid manufacturers. And that settlement occurred, and those dollars are coming to us now, and they have been for a little while. And we're using those in a number of ways. And the most recent kind of push has been through the Harm Reduction Act and Prevention Act. And we're doing things like funding fentanyl test strips. And that's some of our work with the African American Opioid Coalition, distributing those, doing education. We're working with the school districts to educate young people in our public schools, because this crisis knows no age limit as far as young people who might stumble into something like this even more readily than other folks. So we have to talk about this. It's real, it can and it does happen to anyone. We want to educate people. We want to help people avoid taking it in the first place. If people are using, we want them to be safer. And ultimately, we want to help people. We want to get them into treatment because that is the ultimate goal. So it's certainly a multi-pronged approach to addressing what's needed. So, we're also looking at more people with lived experience being able to help, because folks know from whatever you're talking about, if you're talking about drug addiction or any other challenge in life, if you can be with someone who's walked the walk, who understands what it's like to walk in your shoes, it's incredibly helpful. So despite everything we are doing, and we're making a lot of great progress, I'd be interested in hearing from the two of you what's still needed. Where do we still need to work? Where are the roadblocks? Where are the areas where someone might need help and isn't able to get it? Charles, maybe we could talk to you first. What do you see is still needed in the community, and where we need to focus our work?
I believe very, very strongly that we need to continue doing what we're doing, but step it up and think outside the box. We have to take on measures that are going to provide opportunities for people to get better, such as, the Good Samaritan law. I mean, that should really be, a great advertisement commercial on our in our social media as well as television. That lets people know when they have been involved in the use of drugs, someone is unconscious or overdosing, or maybe uh, even worse, that you can call the authorities, you can remain there, and the authorities will come, first responders, and take custody and care of that person versus being fearful and leaving and running and leaving the person there to die. We see that a lot because people are afraid they're going to get caught. They've been using drugs or on probation, parole, or they've been involved in other situations. We have to think about and think outside the box on how we can continue to improve those measures. People are going to use drugs. So we have to be willing to step out and provide opportunities for these people to get their lives back together, become, as I said earlier, a positive in life and not a negative for life. We have to give them an opportunity to get a second chance. I do believe people deserve a second chance. Now, we have people who do very dangerous and very disastrous things. I agree. We must hold them accountable. If that means incarceration for life, that means incarceration for life. But some of the violations that we see, where people, treatment can play a major part. I think that has to be part of the plan. Treatment, holding them accountable, sanctions, what have you, education, training, all these particular areas we have to continue to improve and do better on.
Yeah. So is there enough treatment available? I mean, and we're talking different types of treatment, right? Some people might need outpatient. Some people might need a place to stay, inpatient. How are we doing in that area? Cheryl, do you have any observations?
We don't have enough treatment resources. I mean, for one thing, the healthcare systems generally have a shortage of healthcare providers, everybody from psychiatrists who can prescribe medications for people who have significant mental illness, to even primary care providers that can provide medication-assisted treatment, to therapists. I mean, there's just a lack of bodies that can provide those kinds of services. So I think that is a wonderful thing about the recovery coaches, is that the recovery coaches can serve as a bridge to at least get a person who wants to find recovery, get them to meetings, hang out with them, spend some time with them, help them learn how to have a life in recovery, to substitute, the life that they have now, using with more positive relationships and connections. And then, of course, I think the job and housing related resources could certainly be better to help people with that transition. The National Safety Council did a study and found that people who are in long-term recovery have longer retention rates. They are more productive at work. Once people have found recovery and are out of that life, they thrive.
They're motivated.
And so they're motivated. And it's really, I mean, in my experience at our agency, I see that every day. So I think the combination of both the treatment provision, the sort of how do I carry on with my life in a positive way, and then practical things like housing and jobs are all critical components.
Yeah,
So if I could just add, I really agree with what Cheryl said. Thank you, Cheryl. That was very well said. I really feel, and I've been speaking about this since my days of law enforcement, we need a treatment bed for every jail cell bed. I really believe we need the bed. I believe the judge and the judges I know here in Dane County are very good people who really want to reach out and help people. They need to be able to sentence a person to 30 days in a treatment facility, just like they can sentence them to 30 days in the Dane County Jail. We need these options. I know it's going to be costly to come up with those types of treatment beds, but we're paying for them anyhow. Yeah. The average homicide in a community, my understanding, when it gets through court, medical treatment, everything that goes on costs the county or people involved right around $2 million. And you think about 10 homicides right there, that's a lot of money. And we could come up with the idea and the thought that we need treatment beds in this community. When a person's ready for treatment, you got to get them to treatment. And you can't tell them to come back in 6 weeks. It's too late.
Yeah, these are recurring themes that we hear over and over. And Charles, Cheryl mentioned the housing piece of this, and I know that you've been working on a volunteer basis with a group that's looking at helping out with some of this housing for people who have suffered from addiction. Is there anything you want to talk about regarding that area and that need that's out there?
Yes, and again, I want to thank you and the county for all your support on what we're trying to do here. We have a non-profit organization called Restoring Roots, and that is established for housing and providing housing, education, training, treatment, employment for people who have been addicted or are suffering from mental health issues, people who have been to jail and gotten out of jail or prison and come home, nowhere to go, nowhere to live, an opportunity to live and be able to live in an environment free of drugs, free of criminal activity, where you have an opportunity to get your life together. You will be able to stay in this facility up to 2 years. Most treatment facilities allow you 28 days of treatment, but after about 10 days, they're ready to push you out of the treatment program because of the cost. So we're looking at this situation, and the county has been extremely grateful and thoughtful and helpful and supportive of moving this ahead, because we need places for people to go live and get an opportunity to recover. And the average person cannot recover from 30 days. A broken ankle, you can't recover in 30 days. When you have a major impact of a drug-induced type situation in the body, it takes a long time to heal the body, mind, and soul.
Yeah, thanks, Charles. And to clarify for people listening, that facility is not up and running yet, but it's something that is moving forward, and that there's a team in the community that's working hard toward that. So, I mean, I think the public awareness, the access to more treatment and housing certainly are some concrete areas that we still need more resources. And I think the overall theme that I'm hearing from the two of you too is, again, it comes back to, our conversation about compassion and recognizing that the right thing to do on a human level in these cases is the right thing to do on a societal level. Because I don't know about you, but some of the strongest, wisest, and most impactful people I know are people who have struggled in their past and, survived those struggles and got through those struggles and learned from those struggles. And those are the folks who, I want by my side when I'm doing the work, because they're so effective and they bring perspective that, I personally don't have, certainly in a situation like that, at least. And so I feel fortunate that, the three of us do live in Dane County, and I'm fortunate enough to be the county executive in Dane County. And I think this is where our community is. I think this is what they want us to do. This is the approach they want us to take. One of our investments that's going to move forward, and I'll wrap up in a few minutes, I'll just mention it briefly, in this kind of continuum, is we are moving forward with the development of something called the Crisis Triage Center. And this will be a facility that will be open around the clock, that people can come to when they're having a mental health crisis, addiction crisis, you name it. They could self-present, or there would be an option for law enforcement to drop them off. It's a place where someone can come in, if they're experiencing a crisis, when, a lot of times now, maybe the only option is for them to go to jail. And as you mentioned, Charles, that's not where they belong. So doing everything we can to provide these alternatives that are the right fit. I mean, we wouldn't take someone to jail if they were having a heart attack, right? So why do we take them there now? Because they're suffering a mental health crisis or an addiction crisis. And it's, oftentimes because those other resources don't exist. So, thanks to both of you for sharing today, your journeys and your knowledge, and giving this overview. I'm just wondering, is there anything we haven't covered? Let me see, maybe I'll start with you, Cheryl, regarding addiction that you would, or this entire issue that you would like people to know about?
Well, I am really excited about the opportunity to partner with the school districts on some of the curriculum that you mentioned. One is a harm reduction curriculum that really teaches high school kids, middle school kids, how to recognize the dangers of fentanyl. And, I think the fact that the school districts are open to that is really exciting, because obviously it's It's a politically charged issue.
Yeah, yeah.
And then for the younger kids, teaching them refusal skills, teaching them self-esteem, teaching them, basically how to just even put words to how they're feeling. These are all things that the school districts do every day, but they're so overwhelmed right now with just the responsibilities that they have. We're excited about the resources that are going to be provided to bring life skills and other evidence-based curriculum into the schools. And so that's another piece that I'm excited about.
And finally, Cheryl, if I could ask you, feel free to share or not share, whatever you're comfortable with. But, I'm curious how this journey for you has impacted you personally. Do you have any personal reflections on, your journey learning about dealing with, the opioid crisis, the people you've come in contact with, et cetera?
This has been, such a wonderful professional and personal journey for me. I can't tell you how much I appreciate the relationships that have been built and the perspectives that have been built through this work. It's touched me deeply. I think it makes us more compassionate. It makes us more understanding that, we have a lot to be grateful for, and a lot of things are handed to us that other people struggle with, or, I think this work has been amongst the most fulfilling, really, of my career. And I think the fact that Dane County has been so open to really this powerful work, I'm just grateful for that.
Thanks, Cheryl. And I really appreciate you taking the time to share your perspective and your experiences with us today. Before we close, Charles, obviously your journey is extremely personal. You not only deal with this on a professional level, but you've dealt with it in the most personal of ways. Is there anything else that you want folks to know? Or if we've covered it, that's good too, right? But is there anything else that you want folks to know, or any reflections on your personal journey that you would like to share before we sign off?
Sure. I'd like to say what Cheryl said was beautiful, and she hit it right on the head. I would also like to say that people should remember addiction is a serious medical issue. It has no boundaries. And no matter what race, no matter what age, gender, income you come from, addiction is a major problem. It's a critical issue facing our country, facing our county right now, that we have to continue to take steps to move forward to conquer this situation. And we can do it together as a team working together. No one person can do this alone. In my professional career as a law enforcement officer for 40 years, the majority of my career, I had to deliver the death messages to the families of loved ones who were not coming home from gunshot wounds, vehicle accidents, overdoses, or what have you. I never expected ever to have to deliver that message in my own family. It was very traumatizing. And my advice to everyone here is to take this serious. This can happen to anyone. It doesn't matter what professional lifestyle you're in, what walk of life you come from. This is a very critical situation facing the American people.
Charles, thank you so much for sharing today and lending your insight and your experiences. I think the message out there for anyone who's suffering from addiction or has a family member who's suffering from addiction is you're not alone. There is help. There are unfortunately a lot of people in your situation, but fortunately there are a lot of people who are ready to be there with you and for you in this journey. I would say feel free to reach out to the Dane County Behavioral Health Resource Center. Behavioral Health Resource Center, just Google it. People care, people are there, and they're ready. Don't give up on yourself. We're not going to give up on you. So thank you, everyone, for being here today to hear this edition of the Dane County Podcast, a very powerful podcast today. And we appreciate you joining in and listening, and we'll see you next time. Thanks. Take care.